And thank you, everyone. Okay, thank you so much, members, for coming. I know we have had a long day, and on behalf of the chair and I want to thank you. We have today 4 bills. Good afternoon and welcome to today's bill hearings for the House and Government Operations Committee. The chairman of the committee is Delegate Jane Pendergrass, who's amazing, and I'm the vice chair. This is a virtual committee meeting, so I ask for your patience if we encounter any technological or streaming issues. This bill hearing is being streamed on the Maryland General Assembly YouTube channel. Remember, even though we're meeting on Zoom, please adhere to our usual committee rules of 1 question and 1 answer from the panel, not 1 question and 1 answer from each individual panelist. Also, please keep your questions shorter than the expected answer. The bill sponsor or a designee is allotted 5 minutes to present the bill. 5 witnesses will each be allowed to speak for 2 minutes in support. Please stay in the hearing until the delegates have had an opportunity to ask questions. Next 5 witnesses will each be allowed to speak for 2 minutes in opposition and then respond to question. And then 5 witnesses that are favorable with amendment will be allowed to speak for 2 minutes in opposition and respond to questions. Please conclude your remarks when you see the timer. That's really important because we have a lot of work. Members must remain present with your video camera on during the entirety of the hearing. Order, and I thank you again for being with us. The order of the hearings is as follows. First is House Bill 1464, next 1389, then 1412, and the final bill of the day is House Bill 1471. Thank you so much. And our staff, really supportive team, are Richard and Susanna. And thank you again for everything you do, and also the lawyers for the committee. Thank you. So let's start with 1464, Delegate Semple Hughes, Maryland Loan Assistance Repayment Program for Physicians and Physician Assistants Alterations. Delegate Semple Hughes, good afternoon.
Good afternoon, and thank you, Madam Vice Chair. Good afternoon, committee. I'm here today to ask for your support for House Bill 1464, Maryland Loan Assistance Repayment Program for Physicians and Physician Assistants, and we're making just some minor alterations. So this bill is a follow-up to a bill that was passed out of appropriations and actually, of course, the entire General Assembly in 2020, and it increased the funding for the state's program and required a study of the program by the Department of Health. The funds have been issued and the study has been published. So our goal now is implementing the recommendations of the study. I would certainly like to thank all those who served on the work group. It was very informational and it's happily moved us in the direction where we need to go. 10 recommendations came out of that study, out of that work group. And so today I am seeking to have your support on implementation of 2 of those. The recommendations makes and the bill requires are twofold. First, they recommend that part-time physicians and physician assistants be made eligible for prorated loan repayment benefits. Second, they recommend that a permanent LARP advisory council be established. This council would serve a number of functions, including ensuring federal funds are maximized, because we do have the ability to match that fund. So that's why we want to maximize as much as we can, prioritizing funding based on available data, and monitoring similar loan programs in other states to ensure Maryland remains competitive. And I reference that because during the process of preparing for the study, we learned that Alaska and some other states have very robust programs that allowed more physicians to be able to help with that loan assistance repayment. So pursuing MDH's recommendations will ensure that the Maryland LARP program remains effective and Marylanders continue to have access to care that they require. Currently, Maryland is one of the top exporters of physicians because of our great institutions we have in the state of Maryland. And so we should be proud of that. We should be proud that there's a high demand for our doctors. But we don't want to lose out on the benefit of what this program does by not being able to assist them in the payment of their tuition and help offsetting it in some capacity. What I wanted to share with this committee is that annual tuition for physicians can be anywhere from $80,000 to $100,000 annually for these individuals. And this program can allow them up to $100,000 tuition reimbursement. So the rural communities and other underserved communities in the state desperately need physicians. So ensuring this program's success into the future will fill those gaps and keep them filled. So again, this afternoon, I do urge a favorable report on House Bill 1464, also making you aware that there are favorable written testimony in your, I used to say packet because we had packets, but on your computer. And feel free to certainly look through those. But we do have a favorable outcome from the Senate. And at this juncture, again, like to have your support. Thank you, Madam Chair.
Thank you, Delegate. I just want to correct something. Today's bill hearings are sponsor only, so there are no witnesses except for the sponsors. Also, we did accept written testimony, and many of the bills have written testimony, which just to let people out there know, we do read them, okay? And they're as important as the oral testimony as well. Now, are there questions for the delegate on her bill? I have Delegate Johnson.
Thank you, Madam Chairman, and thank you, Delegate, for this bill. I want to make sure I'm straight on this. Now, is this a loan that they can get with like low interest loan with reasonable and flexible payback arrangements, or is this does it pay off some of their loan, or exactly? How is it structured?
Sure. Thank you, Delegate, for the question. It is a repayment for their loans.
Oh, okay.
So the state can help in that capacity of up to $100,000. And as I mentioned, that the state would overall for the program put in a certain amount, and then we're able to then maximize those federal funds because they match it.
Okay,
but
I got it.
The individual, it certainly is a repayment for their loans.
Gotcha. Thank you. Thanks for clearing that up. Thank you, Madam Chair.
My pleasure. We have Delegate Hill next.
Thank you. Thank you very much, Madam Speaker Pro Tem. Looking at the report and the 10 recommendations, you said that this addresses 2 of them, which I guess is number 10 or number 9 from a permanent advisory council. And I'm not sure which of the other ones this serves. So and you said the funds are there. Is that in the original budget and they're appropriated just for this year or going forward, or what's going on with those funds? Yeah. Because they talk about general fund resources and non-general fund resources. So I'm just trying to.
Right. So then, I'm sorry, I took myself off on mute. So let me say this, is that to answer the first part of your question, those 10 recommendations in the report, and actually it's in the executive summary, might be a little bit faster to look at if you have a chance. Some of those are implementation items that can happen within the Maryland Department of Health, so they can do some of those things without legislation. Some of the other areas are pieces that require legislation. One in particular, just to highlight, is one where they want to create this pool data to have all this information in and know about all the physicians and knowing about how the information can be accessible, but that's going to cost quite a bit. And it's also going to take time to even get it to the point of studying it and seeing what that looks like. So that's part of the reason in this bill, I'm asking for a permanent advisory council, because the one we had temporarily, they did an awesome job and came out with an awesome report. So permanently, it will really continue to have us access and look at other funding streams. To answer your question about the funding, the governor in the past has supported this and put monies in. In this particular year, he has put in about, I believe it's 1.4 million. And to that end, that would break down by 1 million general funds, and then the 400,000 is from the Board of Physicians. Lastly, the Board of Physicians for years have been the only, or the main, let me say the main source of funds, but we're trying to move away from that because we can diversify the funds for this program. That's why we want to look at the other models of where Alaska and other ones have diversified it in addition to the federal funds.
Great. All right. Thank you very much. I appreciate that very thorough answer.
Sure, you're welcome. Thank you.
Any other questions for the delegate? Seeing none, thank you so much for your testimony today. And this will conclude the bill hearing on House Bill 1464. Next, we have House Bill 1389, Delegate Bagnall, Maryland Department of Health, Prevent Workplace Violence in Healthcare Settings Public Awareness Campaign Work Group. Delegate Bagnall.
Thank you, Madam Chair. Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. For the record, I'm Delegate Heather Bagnall, District 33, Anne Arundel County, here on behalf of House Bill 1389, Prevent Workplace Violence in Healthcare Settings Public Awareness Campaign Work Group. You have my written testimony, so I will try to summarize. As you sit here at your computer, do a quick Google search of workplace violence in healthcare settings. The results are staggering. Since 2018, before the onset of the pandemic, healthcare providers, nurses, hospitals, emergency departments have been raising alarm bells regarding a staggering rise in violence against healthcare workers. It is not an exaggeration to say many of us owe our lives to healthcare workers, especially during the COVID-19 pandemic. It is our turn to protect these healthcare workers from injury, violence, and abuse. According to the Occupational Safety and Health Administration, approximately 75% of the workplace assaults reported annually occurred in healthcare settings. Workers in healthcare settings are 4 times more likely to be victims of workplace violence than workers in other settings. Further, because workplace violence is grossly underreported, the actual number of violent incidents is likely significantly higher. And this rise in violence has just been further exacerbated by the pandemic and the strain on our already strained healthcare system. The experience of workplace violence has not only physical consequences, but personal, emotional, and professional consequences as well. Although hospitals and other care providers have taken multiple measures to address this issue, workplace violence continues to increase. House Bill 1389 would require a work group to establish a public awareness campaign to prevent workplace violence in healthcare settings. This work group would provide the public with information on the magnitude of the incident of workplace violence in healthcare settings in Maryland, the consequences of workplace violence in healthcare settings, the need for the public to respect and protect Maryland's healthcare providers from workplace violence, and the need to recognize and accommodate the needs of patients with mental health, substance abuse, and substance use disorder. The work group would also develop a plan for how to distribute the campaign message. Now, our healthcare providers are there for us when we are at our most vulnerable. They have been lauded as heroes, but workplace violence is a crisis for these same providers who are leaving our workforce vulnerable and our healthcare workers behind. We need an immediate and exhaustive effort to help our healthcare workers, and we need to understand the full scope of this issue and make that public. We have 2 amendments regarding the membership of the work group. We need to help our helpers now so they can focus on care. And for these reasons, I request a favorable report on House Bill 1389.
Are there any questions for Delegate Bagnall? I'll start with Delegate Lewis Young.
Thank you, Madam Chair.
My pleasure.
I guess my question is, why a work group? We know this problem exists. We've known for well over a year. And while, yes, the violences and threats are underreported, we know they exist and have plenty of documentation. Why not do something a bit more aggressive than a work group that would be a deterrent to threats or violence against healthcare workers? Why not establish a penalty? There are penalties established for threats and violence against all kinds of other groups. Why not go straight to that?
It's a great question, and thank you for the question. That's not what this bill does, and I don't think that you're wrong. But this bill is about a work group for a public-facing campaign. Because you are correct, we know that this is a problem. This is about staffing a work group to design and define that campaign to get this issue out to the public and to hold the department accountable for making sure that we have a public-facing campaign. So that's what this bill does. In terms of penalties, you're not wrong. It's just not this bill.
I recognize that, but for my own community members who have been faced with threats and violence and are resigning their jobs, I have a hard time saying to them, we're going to do a work group. I mean, I respect your efforts, but I really think we need to be going further. Thanks.
Delegate Johnson, followed by Delegate Hill.
Thank you, Madam Chairman, and thank you, Delegate, for the bill. I know we all know about violence against healthcare workers, that they do run into that occasionally. But I really, before we go imposing penalties and fines or whatever, I would really like to know from a work group how many of these threats or violence are committed by people with mental health issues or in a substance abuse issue where they're really not in a right mind before we start talking about penalties. I really would like to have that information first.
And I appreciate that. And again, this work group is about bringing the expertise to the table to define the scope of the issue, to define what that public-facing campaign would look like, the message, what that message needs to be, and how to get it out to the public. So this strategy is trying to make sure that we aren't, to your point, criminalizing people who are in need, but recognizing that this is an issue for our healthcare providers, and it is a major workforce. It's a major workforce issue as well.
I guess my question would be, is that information going to come out of this study?
Again, I would have to get back to you on that. I think the short answer is yes, because this was actually a bill that was requested by the advocates. This was the approach that they wanted to take. So
I get the reason. I just would like to have the information. So
I think the information is already sort of baked into the membership of the work group. So if it's the will of the committee that we more clearly define that, I'm happy to look at how we can more clearly define that in the bill.
All right. Thank you. Thank you, Madam Chair.
My pleasure. We have Delegate Hill next.
Thank you, Madam Chair, and thank you, Delegate Bagnall, for this bill. Two quick questions. One, you mentioned two amendments. Are they the same ones that the Maryland Nurses Association requested?
Yes. So the two amendments, one removes the developmental disabilities community from the work group. They were inadvertently put on the work group, and the advocates are concerned, and I think it was a valid concern that it might inadvertently malign our adults with disabilities community if they are sort of put into this this conversation, because it's a different setting, and it's a different, those healthcare workers have a different approach. And the other was requested by the nurses so that we do have the expertise of the state's attorney. So you should have them on your floor system. And I think they were also emailed out. So those are the amendments that I'm offering as a sponsor.
Okay, because the Nurses Association had also asked to add some other language that you'll see in their testimony. But the second part of my question is, I'm slightly different from the previous two delegates. I'm wondering why to come up with a forward-facing PR campaign, we can't just direct the department to come up with one. Now, the information's there and coming up with them, they would normally touch base with these folks anyway.
I don't know about anybody else, but Delegate Hill, I can't hear you.
Can anyone else hear me?
Yes, can you get closer, Delegate Hill, to your camera
Okay.
and put the
Is that any
volume up a
better?
little bit, please?
Is that better?
Yes.
Okay, thank you. So my question is, why not just direct MDH to develop a campaign? In doing so, they would naturally touch base with all of these stakeholders anyway. So that it's similar to the previous question, but I'm not asking about the data and all that kind of stuff. Not asking about penalties. I'm saying if we're saying there should be a campaign, why not just have MDH develop a campaign?
It's a good question. I think it's because we want to be a little more at the table. And we want to make sure the people that are most impacted are the ones that are driving the conversation.
Okay, all right, thank you.
Thank you.
Okay, any other questions for the delegate? Okay, seeing none. Thank you very much, Delegate Bagnall, for your testimony today. And
Thank you.
again, there's written testimony in the file. This will conclude the bill hearing on House Bill 1389. Next, we have House Bill 1412, Delegate Kerr, Public Health Parkinson Disease Registry established. Good afternoon, Delegate Kerr.
Good afternoon, Madam Chair. Members of the Health and Government Operations Committee, Delegate Ken Kerr here with what I hope is my final bill presentation from my 2022 legislative package. Today, I bring you House Bill 1412, Parkinson's Disease Registry Establishment. Parkinson's disease is a long-term degenerative disorder of the central nervous system that mainly affects the motor systems. The symptoms emerge slowly, usually after age 50, and Parkinson's disease is more common in men. The most obvious early symptoms are tremor, rigidity, slowness of movement, difficulty with walking. Cognitive and behavior problems may also occur, depression, anxiety, and apathy. As the disease worsens, non-motor symptoms become more common, as well as dementia, Alzheimer's disease, the loss of the ability to swallow, as well as hallucinations and delusions, in some cases resulting from Parkinson's disease psychosis. There's no treatment to slow, stop, or reverse the progression of Parkinson's disease, and there is no cure. And we really don't know what causes it. House Bill 1412 will establish a statewide Parkinson's disease registry within the Maryland Department of Health that will disseminate relevant population data from patients living with the disease to the Center for Disease Control National Research Database. The Maryland Department of Health Registry will ultimately provide researchers across the country with the best possible chance to use this data about prevalence patterns and other demographic information that could help to find a cure for this progressive chronic disease experienced by over 1 million Americans, including over 100,000 military veterans. Approximately 60,000 new cases are diagnosed each year. And while the federal government spends $280 billion each year to care for Parkinson's patients, it spends only $180 million on research to prevent, treat, and cure the disease. Creation of this voluntary registry will collect disaggregated patient information upon diagnosis to the Maryland Department of Health to further CDC research and planning for healthcare requirements and for educating healthcare providers. Now, there's a fiscal note that I and the advocates believe to be inaccurate when you compare Maryland's population to the other states that have established Parkinson's disease registries. We think that the cost will be of the registry will be closer to that of Massachusetts with a similar population at around $250,000. So the data collected can reveal patterns in the disease, possibly leading to prevention, as well as assist the state in healthcare planning for those suffering with Parkinson's disease. And I request the committee issue a favorable report for House Bill 1412.
Thank you, Delegate Kurt, for your testimony today. Are there any questions for Delegate Kurt regarding House Bill 1412? Seeing none, thank you so much. This will conclude the bill hearing on House Bill 1412. Next, we have the last bill of the day, House Bill 1471, Delegate Beitzel, Garrett County Memorial Hospital Lease Authorization and Alterations to Board of Governors. Good afternoon, Delegate, and welcome to HGO.
Thank you. Good afternoon, Chairman Pendergrass. I'm not sure if you're there, but Vice Chairman Pena Melnick.
She's here. She's always here.
Okay, all right. And fellow members of the committee, for the record, I am Delegate Wendell Beitzel, and I am here to present House Bill 1471 entitled Garrett County Memorial Hospital Lease Authorization and Alterations to Board of Governors. This is a technical piece of local emergency legislation related to the management of the Garrett County Memorial Hospital in Oakland, Maryland. The county owns the land and the hospital. It owns the hospital and the land that it sits on. And for a variety of factors, the county, the hospital board of governors, and other stakeholders have unanimously agreed that the best path forward for the operation and long-term beneficial use of the hospital is to lease it to the West Virginia University Medicine at West Virginia University Medical Center at Ruby Memorial Hospital, and they have other affiliates. West Virginia University Medicine already operates a section of the hospital, and that partnership has been very fruitful for all parties involved. And basically, the Garrett Regional Medical Memorial Hospital is already being operated by West Virginia University Medicine. The Garrett County Commissioners operate with a commissioner form of county government. So being a county commissioner form of government and with only 3 county commissioners, the state code would require that they need permission to enter into leases and sale of property and to be able to authorize, negotiate, and execute documents to carry out this action. The commissioners requested this bill and the authority that it provides. It was submitted as emergency legislation because a prompt resolution is necessary to keep the hospital running smoothly. And I was not notified of this situation until after the bill requested deadline. The Garrett County Commissioners requested this legislation. The Garrett County Memorial Hospital Board has approved it. Garrett County delegation on the House side of 1, which is me, supports this. And the Garrett County delegation of 2, which is Senator Edwards and I, support this request for this legislation. And therefore, I thank you all for your time, and I urge you to give a favorable report on this request in this bill.
Thank you. Are there any questions for the delegate? Seeing none, Delegate, I looked in the file and there's no, the only witness is you. There's no letter from the Garrett County Commissioners. There's no letter from the hospitals, and there's no letter from the Senate across the street. Can you get those letters, please?
I will get them promptly to you. I'm sorry that hasn't been done already, but you will have it
Yeah.
with.
My
Okay.
pleasure.
All right, thank you so much
Thank
for allowing me to present this.
Thank you. I don't see any other questions. So this will actually conclude the bill hearing on House Bill 1471. Thank you so much for being with us. And the committee members, you have government operations next. And then right after that, 45 minutes later, we have the public health subcommittee and we have voting as well. So stick around, okay? Take care.